Long sitting hours can silently pull your pelvis forward and overload your lower back. So, if you constantly feel low back tightness, stiff hips, poor posture, or your stomach sticks out, you might have anterior pelvic tilt. What is anterior pelvic tilt? Anterior pelvic tilt means the pelvis rotates forward. This increases the arch in the lower back and creates extra stress on the spine. Think of your pelvis like a bowl of water. In neutral posture, the bowl stays at the level. But in anterior pelvic tilt, the bowl tips forward, causing excessive lower back arching. The biggest cause is prolonged sitting and abdominal weakness. Over time, back extensors become tight, glutes become weak, and hip flexors become tight. Other causes include poor posture, obesity, pregnancy, and improper gym training. Now, quick self test. Lie down with knees bent. If your hand easily passes under your lower back with a large gap, you may have anterior pelvic tilt. It's just a functional test. To be sure, get yourself assessed by a physiotherapist. Hip flexor lunge stretch. Come into a lunge position with one leg forward and one knee on the floor. Gently tuck your pelvis backward and shift slightly forward until you feel a stretch in the front of the hip. Do not overarch the lower back. Hold this for 30 to 45 seconds on both the sides. Second is Psoas Stretch on bed. Lie near the edge of a bed. Bring one knee toward your chest and let the opposite leg hang down. You should feel a deep stretch in the front of the hip and thigh. Hold this position for 30 seconds. Next is child pose. Sit back onto your heels and stretch your arms forward. Relax your chest toward the floor and focus on slow breathing. This helps relax the tight lower back muscles. Hold it for 30 to 45 seconds and repeat it for 3 to 4 times. Next is mobility drill for posterior pelvic tilt. Lie on your back with knees bent. Now tighten your abdominal muscles and gently flatten your lower back into the floor. Imagine tucking your pelvis backward. Hold for 5 seconds and repeat this 10 to 15 times. Next is glute bridge. Lie on your back with knees bent. Push through your heels and lift your pelvis upward. Squeeze from the glutes and avoid excessive lower back arching. Hold for 2 seconds and slowly lower down. Repeat this for 10 to 15 repetitions. Next is hip thrust. Rest your shoulder blades on a bench. Push through your heels and lift your pelvis upward while keeping the core engaged. Focus on glute activation rather than lower back movement. Repeat this for 10 to 12 times. Next is reverse crunch. Lie on your back with your neck slightly bent forward. As you lift your legs and pelvis upward, swipe your hands along the mat under your lower back. Move slowly without using momentum and focus on squeezing the lower abs. Repeat for 10 to 15 repetitions. Next is crunches with hamstring activation. While pulling a TheraBand using your legs, perform the controlled crunches. This improves coordination between the core, pelvis, and hamstrings. Move slowly and avoid pulling from the neck. Repeat this for 10 to 12 repetitions. Any form of pelvic asymmetry, it's not just a posture issue, it's a movement control issue. That's why only stretching or only strengthening usually doesn't work. Remember, small consistent corrections daily are far more effective than aggressive workouts done occasionally. Thanks for watching.